All right, welcome everybody. On behalf of our superintendent of schools, John Carroll, we want to welcome you and thank you for being here today. Happy New Year, and we're glad to be able to bring you an update on COVID-19. My name is Mike Grant. I'm Assistant Superintendent at the Marin County Office of Education. And today, the webinar today is being recorded and will be available on our Rethinking Schools website. It's also being presented in English with simultaneous Spanish translation. I'm going to hand it with Margarita Lopez, who's our interpreter today. Michelle Draco is now going to share how to hear the webinar in Spanish.
Thanks, Mike. Hola. Este webinar se transmite simultáneamente en español. Haga clic en el botón de interpretación del idioma que aparece en su pantalla si desea escuchar esto en español. Muchas gracias a Margarita Lopez, que es nuestra intérprete esta tarde. It's really sad that that's one of the last times we'll be saying that, since this might possibly be our last COVID call. Take it away, Mike. Take it away, Dr. Willis.
Okay, thank you so much, Michelle and Margarita. So we're joined here today by Dr. Willis, our public health officer, and we're going to get a status update on COVID-19 and other important topics of interest. Is this the last call? Well, today is going to be our final pre-scheduled public health update as of now. And of course, we know if there's a need to reconvene, we will certainly do so. But just to give a little bit of context about today's public health update, it was a little over 1,000 days ago that we had our first COVID-19 public health update, 1,003 days to be exact. It was Monday, March 9th, 2020, and it was just about a week before the shelter in place started. And we literally had the room next door to us set up with 200 chairs. We were expecting a packed house. And as we were counting down to the meeting, we got the update from public health that there was new guidance of not having so many people in an indoor space and not more than 100, and you had to have 3 feet of distance between people. So we quickly rearranged the room and we got the word out that we're going to go to a Facebook live call, and we're discouraging people from showing up. We still had people showing up. But since that day, this is the 55th public health update that we have conducted. Some have been with school leaders and labor leaders and parents, and then general updates to the whole school community. So Matt, we can't thank you enough, and Dr. Santora and your whole team for the support you've provided our community. And this will be our last scheduled meeting unless things change, which we know they always can. But with that, one thing about questions, if you have questions, please put them in the Q&A section of the webinar. And at the end of the presentation, we'll be happy to answer those. There's also rapid response at marinschools.org still as a source if you have questions that weren't answered in today's webinar. But with that, we'll hand it over to you, Dr.
Thank you.
Willis.
1,003 days. Yeah, I was just looking back at some of the early presentations. We had one case. We only had one case in Marin County at that time.
Yeah.
And now, we've got probably over 100,000. Another, I think, strong sign that things are winding down is that it's just you and me. Mary Jane, Lisa Santora. Lisa Santora, apology, she was unable to join us today, but obviously Lisa has been a critical voice and asset for us. And we're excited to welcome John Carroll as the new head. John was a great champion for us along the way, and Mary Jane has had a lot of successes, and I think one of them was helping John get into this seat, and we're looking forward to working with John moving down the road. Next slide, please. So we're going to talk a little bit about pandemic recovery and resilience. At the same time as we're offering an update for what's active, we also make sure that we're sort of setting the stage for a healthy future as we come out of the pandemic. Next slide, please. And this is just to reground us in one of our operating principles all the way along. This was something that even on that very first, meeting over 1,000 days ago, we stated that we would be grounding our strategy in the World Health Organization definition of health, which is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And that principle of really trying to marry physical well-being and the risk of infection with what we know to be mental and social well-being with being in school, full-time classroom-based learning, was really an important balance point for us and led us to, I think, one of our greatest success points, which was having kids be in school earlier and safely than most other jurisdictions. Next slide, please. So I'll start with some of the triple-demic update and then get into COVID. Next slide, please. So there are a lot of respiratory infections still out there. We have RSV, we have coronavirus, we have influenza, rhinovirus, parainfluenza, and at one point, over the last 2 months, has been at least, almost every week we've had something. Are we okay internet-wise? Okay, great. Most of these are, self-limited. Like what we would call the common cold is actually a variety of different viruses that are circulating right now. When we look at the molecular properties, we actually do see that there's a whole range of different viruses. So the take home is that really to seek healthcare if you or your child is having more severe illness, so high fever greater than 102 degrees, non-resolving fever for more than 3 days. Certainly, if the child looks or acts very ill or is unable to be, woken or roused, so those are obviously reasons to seek medical care. A severe cough that is unmitigated and any trouble breathing, those are signs, red flag signs that you should seek care for your child. And you can learn more at the website Healthy.
On this slide, to put in a plug for coming to get more rapid antigen tests, ordering your own. Schools now should be ordering their own. Districts, public school districts, private independent local schools should be ordering ongoing supply of rapid antigen tests, which are still available. We don't think that will end, be forever. So stay stocked up. We still have a significant inventory here. If anyone needs some, reach out to us and keep those tests getting out into the homes is our recommendation for staff as well as students and families.
And that is thanks for bringing that up. That's a particularly important point now. Just the governor just announced the new budget. There's not a lot of budget for ongoing provision of tests from the state and from the feds. And so what we have available to us may be what we've got. Right. So stock up like squirrels, we're the winter. We need because we're probably not going to have an ongoing supply of tests down the road. And we might anticipate that there would be potential surges in cases where we're going to need more access to tests. Thank you. Next slide, please. This is just to share our data on flu. We saw a rapid increase in influenza. The good news is that it seems to have peaked and is now on the decline. Next slide, please. And similarly for RSV, we saw an increase. This just the latest data today. I was able to get a verbal on the fact that is also starting to come down a little bit. That little peak there we see at the end is probably related to Christmas and New Year's gathering, just over the holiday. But the general trend for RSV is a downward one. Next slide, please. I think that's reflected here where we see these are RSV hospitalizations in Northern California. And what you can see is that it was a pretty serious year for us in terms of RSV hospitalizations earlier in the year, November, December, but that is now declining. And those other colored lines represent other years where it was later and less severe. Next slide, please. So stay safe and well. Remember, just stay home when sick. Return when you're feeling ready to learn and work, and you're fever-free for 24 hours. Masks are still important as primary tools for prevention. N95 masks will prevent people from inhaling the virus, whether that's RSV, influenza, parainfluenza, any of those viruses that are out there. You will be protected against if you're wearing one of those higher quality masks. So people who are at higher risk for more severe illness should certainly be continuing to cover their face in public settings. That's if you're having symptoms, certainly please wear a mask, washing hands frequently, not touching your face, and then getting that flu shot. I think the take home here, the most important measure any of us can take is to make sure we have the protection of the vaccine. The flu shot and the bivalent booster are both highly protective against this most significant threats that are out there right now. Next slide, please. So shifting gears to COVID-19, next slide. So these are the priorities for us monitoring for COVID-19 in 2023 and subsequent updates, whether it's online or in other forums. These are the things we'll be focusing on is the amount of virus we're seeing in our wastewater, because that tells us a lot about community virus activity. Amount of hospitalizations, because that tells us about virus severity and burden. The deaths, again, virus severity and burden. We'll also be looking at local variants. I'll talk about that in a minute, and that helps us forecast what our experience might be. We'll also be looking at state, national, and global trends that also help in forecasting. For example, what's happening in China right now is important for us to keep an eye on because it might predict our experience. And then we'll be looking at outbreaks in congregate settings for real-time response. That'll guide our ability to offer technical assistance and other supports for settings, whether they're long-term care facilities or schools where outbreaks are occurring. The schools are currently reporting weekly cases to us through spots. And we want to encourage our school representatives to remember to continue with those weekly reports. We don't need line items of every single individual, but just the number of cases on a weekly basis. And remembering our definition of an outbreak is 5% of the total school population. And that triggers us to be able to respond and help with mitigating or interrupting chains of transmission. So those are our priorities ongoing. This is something that we put together today, and I think really starkly tells that story of how case rates themselves are really no longer offering us that complete visibility we need. This is the wastewater levels are the blue line. Case rates are represented by those tiny bars, and what you see is, earlier on in early 2022, the case rates and the wastewater levels tracked pretty well together. But now we see that our wastewater levels have increased significantly while our case rates continue to decline. And basically what that means is that, with probably because of home testing and people not reporting results, we're not measuring as many cases, but that we could easily be falsely reassured by that. And then when we look at the wastewater, we're seeing levels that are ever increasing with the emerging variants. Reassuring that we're not seeing a commensurate increase in hospitalizations with that surge in transmission as evidenced by the virus, by the wastewater. And that's probably because of the protection of the vaccine and the fact that the circulating variants are less severe. Next slide, please. So again, this just looks at our wastewater over time, and we have 5 different sources of wastewater in Marin, and each of those is tracked by a different color there, and then the average is represented by that blue line, and that's available on our website. For anyone who want to track this moving forward, to me, this is the single thing I look at most when I want to understand how much COVID is moving in our community, and this is available on our surveillance site. Next slide, please. Hospitalizations. This shows that right now we have 25 people in the hospital in Marin County with COVID-19. 11 of them are in the hospital for COVID-19. That's that lighter blue line. We make a distinction between people who are in the hospital because of actually the severity of illness that COVID-19 causes versus people who might just be incidentally in the hospital, might be there for a broken leg or pancreatitis or some other issue, but happen to be also infected at the same time. Next slide, please. So this is what's happening with the variants. And this, I think, is going to be important for setting the stage for the early 2023 experience. We've had 16 distinct variants or subvariants among 43 total results since mid-December, which is the widest range. Normally, we would have like 2 or 3 total variants. And, if you remember, we had 100% BA5, for example, for months and months. Now we're having this explosion of diversity of different variants, 16 distinct variants, all Omicron descendants, but it is the most diverse range we've ever had. And it signals less predictability for us because it's not exactly clear which of those variants is going to emerge as the dominant one and what its behavioral characteristics will be. Next slide, please. And this is also just a screenshot of our website that shows there on the far right, the yellow is XBB, which is emerging. The orange is the BQ. And then the red is the BA5. And you can see that among those, it's really pretty much evenly distributed between those three after months where it was really only BA5. Next slide, please. So a little bit on XBB 1.5. If you're paying attention to the national news, this has become a story. I think the New York Times called this the Kraken variant. It is a categorically different variant. It's the first one that is a combination of two previously circulating variants, so it sort of acquired one of the favorable characteristics of one variant and then one of the favorable characteristics of a different and combined them into one. It is likely our next dominant strain. It's contributing to rises in cases nationally. About half of the cases in the US now are XBB 1.5. It is more contagious, which is the reason why these strains become the dominant strain is that they have what we call a growth advantage. They're able to move more quickly through the population and take over the previous strain. So it is more contagious and more immune evasive. Good news is that there is no sign yet that it has any increased severity over other strains. And even better news is that the bivalent vaccine is effective against this. And this is brand new news over just the past week or so. We've really been able to determine that, thank goodness, that bivalent vaccine that became available in September is actually protecting people against severe illness with XBB 1.5. Next slide, please. So bivalent booster effectiveness, we want our community to be aware that bivalent booster is going to be protective and remains protective. It protects against the original strains, the BA5, the BQ, and the XBB strains. Antibody responses are consistent between younger and older adults, so it protects people in all age groups. And new data from Marin based on our real world outcomes, we found that it's reducing risk of hospitalization by about 1/2. And the way we calculate that is basically just comparing people that are in the hospital, who've had the bivalent booster versus who haven't. And about half as many people that have had that booster are coming in compared to people that have not had it. And then we're seeing similar results from national studies and the effectiveness of the bivalent booster against the current strains. Next slide, please. So this is some of just to signal, this is our last of these meetings, but we are certainly not stepping away from just our ongoing support for the schools in 2023. Our team at Marin County, we have established a new team dedicated to schools within communicable disease team at Health and Human Services. We have biweekly liaison meetings with our newly established public health liaisons. That's new infrastructure at the school level. Public health liaisons, super effective tool. And wonderful people, at every school, really reaching out and having that relationship with public health. We meet with them every 2 weeks now to offer technical assistance on infection control, testing, ventilation, any other measures that would make the school a better protected setting, guidance on outbreak prevention and mitigation. And this is not just for COVID-19, this is for other conditions as well, measles, whatever it might be. Also guidance on maintaining those reporting expectations, connecting people to resources, whether it's testing or vaccinations, and then just offering educational materials that might be relevant for staff, students, or parents. Next slide, please. Yesterday, you might have heard that the federal pandemic state of emergency was renewed. So it was scheduled to end at the end of January. Sarah, the Director of Health and Human Services, announced yesterday that they're renewing it, so it's not going to end. It has been in place since January 2020. It has been extended 12 times. The reason it was extended is that average cases are increasing. The daily cases across the nation, 17% increase compared to a week ago. And it's largely due to what I just explained about the XBB 1.5 variant, which has a growth advantage over previous variants. California and Marin are slated to end our state of local emergency on February 23rd, and there's no signal yet that that would change, despite the change in the federal announcement. Next slide, please. Just getting to I think what emerging as one of the most important determinants of our sort of global pandemic experience moving forward is that China, after years of the zero COVID policy, has had a radical shift in their policy and their approach. And COVID-19 is moving very quickly through that population of over 1 billion people. It is mainly the BA.5 strain. That's a concern, obviously, from sort of a global standpoint, because there's so many people, literally millions infected over a short period of time, opportunities for new variants to emerge, and obviously the disruptions that might cause the supply chain and other issues from an economic standpoint globally, if China does have more severe issues and if the healthcare system there is overwhelmed. So travelers, one of the rules, travelers returning to the US from China now have to now show proof of a negative test beginning on January 5th. And the impact on California is uncertain currently, but we will be watching that situation carefully. Next slide, please. And I would just say that's another reminder, I think, for all of us, that this is that we are part of a single kind of global ecology. As much as we think locally, the pandemic has really taught us that we are part of this wider global community and need to make sure that everyone has opportunities to get vaccinated and get treated. This is, I think, my last slide, and just in terms of COVID, and this is very good news. Basically, on the blue line shows decreasing severity of illness. What it shows is that percent of people who are infected who end up passing. And as early as the earliest surge, 7% of people who were infected actually died. And now we're well less than 0.2%. And that's among known cases. We actually know there's a lot more cases than occurring than we're measuring. And then the red line shows our vaccination rates. And you basically just see how they're flipped. High vaccination rates have led to much lower severity of illness and lower mortality. And that's part of Marin's story. Marin's legacy is very high vaccination rates and correspondingly some of the lowest death rates of any community.
Has there been progress? I know the bivalent uptake wasn't as strong as some of the earlier boosters. Has that been making progress?
We're seeing progress, especially in the population you're most interested, most concerned about, which is our above age 50. Yeah, we've had the highest vaccination rates for our elder residents of any county in the state. Still not enough. Still not satisfied. It's about 2/3 of our older residents are vaccinated, which means 1/3 are not. And that's a concern, especially as XBB starts to march its way across the country. Next slide, please. So I'll end with just a little bit an update on OD-free Marin. We've talked about how as the dust settles around some of the pandemic response, what we're seeing emerging as another public health crisis is the crisis of overdose. And that's a national trend in Marin County. Overdose is the leading cause of accidental death. Overdose rates have doubled in the past 3 years. Fentanyl is really the primary driver of that shift. And characteristically, Marin County Office of Education has really stepped forward to join us in the response to that crisis. Next slide, please. So OD-free Marin is our community coalition dedicated to preventing overdose deaths. The school community has partnered with our Safe Marin through the youth action team. OD-free Marin has 5 different action teams that are represented here. The youth action team has strong relationships with Marin County Office of Education, and there are work groups that are named here: one on wellness and mental health supports, Narcan distribution and training. Narcan is the drug that reverses an overdose when it occurs. We want to make sure it's in all schools. We're doing an expanded curriculum training to make sure that there's curriculum at the school level to make sure that our staff and students are well educated about the risks, and then parent and family education. Those are the work groups organized through NCOE to support OD-free Marin Youth Action Team to prevent overdoses in our school community. Next slide, please. And I'll just highlight the high-level strategies: education and awareness, youth-led messaging and outreach. Really important to us that the messaging is actually led by people who have stepped forward from our young, from our students. Just say no, KNOW, instead of just say no. We've learned that that doesn't work. Pure abstinence message doesn't land well. but having people understand what's at stake and really taking more of a trust around the impact of knowledge is important. Narcan access, as I said, Narcan is the drug that reverses an overdose. We want to make sure that it's widely available. And I'll talk more about that in a second. And then mental health and substance use support, making sure that people who have substance use issues or addiction actually have access to the treatment they need and deserve. Next slide, please. Narcan. So one of our ambitious goals was to make sure that every school would have Narcan on site with trained staff. I wasn't sure we'd be able to pull that off, but
we're close. We're proud, you know, to be probably among the first counties, the first county in the state to have, you know, naloxone that either distributed to or available to all high schools and middle schools. So there's still a handful of schools that have not come to pick it up. It's waiting here for you. You know, we've gotten a grant with the support of Moran and the team. So the goal is to have it in every school, every middle school, high school, not private because it's appropriate. So if you haven't gotten yours yet, please come pick it up. And it includes training from the SPAR Center.
Yeah. I mean, how great was, you know, to be able to say that every single school has Narcan on site.
Yeah.
And we can't say that yet.
Not yet. We're close.
Yeah. All right. Well, but so that's the goal. All public schools have Narcan on campus. Private schools can contact MC League for pickup. And that's all being coordinated under ODP. Next slide, please. And as we said,
yeah,
you want to take this?
Yeah. So you know, this will be our final pre-scheduled meeting. We're going to stay in touch with public health, and depending on how the future of COVID unfolds, we would of course congregate again as soon as there's a need to for additional updates. And I do also want to say that I want to thank our tech team, Jared and Alex and Sergio, for jumping in. We had and just so you know, while we were frozen, we were trying to do a mindful moment, lead you all through a mindful moment, take a deep breath, and recognize all the good things that we have in Wayne County and in our community, and how fortunate we are to have such great partnership with public health and one another. So take that time. If you weren't there to be led to that, you can take that time at the end.
It was intentional.
It was. And Melina, do we have any questions in the chat?
We do not have any questions.
Okay, so I have a question. And then we were talking about this before. Some of the question that has come up among my family and my colleagues is, okay, for those of us who have taken the boosters, the vaccines and boosters along the way as directed by our physicians, is there an indication that the bivalent booster there'll be a new version of it, or will it be an annual thing, or is it still like, it seems like it's been on a kind of 4 to 6 month cycle where it starts to lose its efficacy? Mm-hmm. And is there any indication from public health of where that's headed with it?
Yeah, I mean, first of all, if you've had the bivalent booster, you've done the right thing. That's, if you haven't, that's the first thing, is that people, if you haven't had a vaccine in the last 6 months, you haven't had the bivalent booster. So that's, but those that have gotten that bivalent booster, there's no recommendation to get another one yet. It is likely that there will be a cadence of potentially annual, like influenza, where especially as influenza, one of the reasons we need annual influenza shots is that the virus itself mutates. The influenza virus mutates year to year. That seems to be the characteristic of COVID, coronavirus that causes COVID-19. So I would not be surprised if we sort of, when the dust settles around this and we have an annual cadence, it's yearly vaccines, could even be combined with a flu vaccine, where you get a COVID and flu vaccine in the same shot. I know they're working on that. The wild card here is what we mentioned about the emergence of new variants. If there is a new variant that the current bivalent booster does not protect against, and all of us are sort of newly susceptible. The good news is, that mRNA vaccines can be rapidly modified. As we saw with the bivalent booster, they added that BA.5 component. Within weeks, it was actually available. So that would likely occur again. So if there's a new variant that is representing a new threat, either by increased severity or by better immune evasion, I think we would expect a new vaccine to be developed. And we may be back on for some of our shared operations with NCOE and Marin County Public Health to get our community vaccinated. That's great. That's great.
Mike and Dr. Willis, we did have a question that came in around vaccinations. Do you anticipate a requirement of COVID vaccinations for the next school year?
We do not anticipate a requirement. There are some diseases do have a vaccine that is required for students to enter school. COVID-19 is not on that list. That's measles, mumps, rubella, and other infectious diseases. The state has not indicated those are state requirements. They are not local requirements, and Marin County would be following state. That's state law. We do not intend at the local level to add to that or to mandate any vaccines locally that are not mandated at the state. And right now, we're not seeing indications that the state intends to mandate COVID-19 vaccine for schools.
Okay, so I think that it's a wrap. Thank you all again for being here tonight on a Thursday evening in January. We hope that you stay dry and it's going to sound like it's going to be another wet weekend. So be safe and don't cross any deep water and pay attention to the Marine Emergency Public Portal is a great source of information to ensure we're staying safe. Thank you for being here, Matt. Thank you for all the work that you and Lisa and your team have done, and have a great rest of your evening. Thank you.
Thank you, Mike. Thank you, everyone.